Hello friends, this is Dr. Rakesh Mittal, Senior Surgical Faculty. Today we'll talk about the TEP, Total Extra-Peritoneal Repair, which is a laparoscopic inguinal hernia repair. These triangles are very commonly asked in your exams. So triangle of doom, which is a medial triangle, that's for the right side. So that's a midline. So medially triangle of doom, laterally triangle of pain. So triangle of doom, the boundaries you must know, that's a deep ring. The medial boundary is vas deferens, lateral is gonadal vessels, and below it's peritoneum. And triangle of pain is a lateral triangle, gonadal vessels, iliopubic tract, and the peritoneal reflection. So triangle of doom, VAP, that's for vas, artery, that means gonadal vessels, and peritoneum. Triangle of doom, VIP, this V is for vessels, iliopubic tract, and peritoneum. Circle of death, also known as corona mortis, and trapezoid of disaster is combination of, so that's a trapezoid. Medially triangle of doom and laterally triangle of pain, that's a trapezoid of disaster. And this is the corona mortis, circle of death, which is around dissection area in TEP. And this is arterial arcade, and the components of it: common iliac artery, internal iliac, external iliac, obturator, aberrant obturator, and inferior epigastric artery. So these are the important triangles in the surgical anatomy of TEP. Thank you.